The core problem is that our system is incentivized and makes money from managing disease, which means more and more patients need to get sick. I don't think that this issue is going to go away. I don't think moms are going to return to wanting, the dyes in the food and, going back to blindly trusting pharmaceutical companies. Or 5-10 years ago, Coca-Cola used to aggressively argue that sugar doesn't cause obesity, like aggressively, like publicly. I believe actually that there's been a historical level psyop of the Democratic Party to use social justice issues to get them to carry water for an evil corporate agenda.
What are the top 3 things of the MAHA movement that we want to put out and make happen?
There are 3 principles Bobby and President Trump talked about that will lead to generational change.
Calley, thanks so much for coming on the podcast.
I'm pumped to be here.
Oh man, I really appreciate you so much. I've known your sister for a number of years now, and it's really been a blessing to get to know you over the past few months. I'm a massive fan, cheering you on from the sidelines, and I'm so excited and blessed that our paths have crossed.
Me too.
All right, let's go back to, I'll set the stage. I was talking to your sister, Casey, in Mexico. We were speaking at the same event in Mexico last December, right? So over a year from now. And we were talking about, hey, like RFK was still running on his own campaign at that point. We were talking about how we were excited about the things he was talking about, bringing health to the forefront, at least having a conversation and raising awareness. And we were talking about this book that was going to be coming out. She's like, yeah, this book, it's going to be good energy. We started talking about it. Little did we know the zeitgeist that would have been created just a few months later. I mean, did you ever see like what has happened for you both over the past few months? Did you ever imagine it?
I will say this. I felt very strongly that there was something societally important in Casey's story and her beautiful way of communicating the interconnected spiritual and health crisis that we have. And we felt after the experience of our mom's death, I strongly felt there was something really important to say, with this mix of Casey, leaving the medical system, her putting the pieces together, it helping me put the pieces together, lobbying for the industry. And then just there was something like so powerful about my mom's story to me. And it was really tragic. She died 12 days after her cancer diagnosis, but it's like Casey and I actually weren't upset about it because we were so emboldened after mom's death to kind of tell this story. And the core thing that I thought was resonant about my mom's death is that the doctors told her that her cancer was unlucky, which it's not. As President Trump said at the State of the Union, childhood cancer has gone up 40% in the last 20 or 30 years. It's like everything's skyrocketing. It's not tough luck. We know why it's happening. It's happening from very identifiable, preventable factors. My mom was on 5 other chronic disease medications, like less than an average medications for a 70-year-old. And those warning signs were missed that led to the cancer. So we felt really emboldened about that. And then we felt emboldened because the medical system only jumped into action those 12 days to really, bill for a bunch of ineffective procedures instead of really jump in to help prevent the car from being crashed. So we wanted to tell that story. And I think, to me, we're one small microcosm in what's happening around the country, which is that so many leaders like you, you've been pushing on this. Mark Hyman is a huge influence of us. He's been pushing on this for 15 years, many people for longer than that. And something happened this year where there's a moment and people have woken up. I liken it to a couple factors. I think independent media is a huge one. I mean, I really got into this, and really got emboldened during COVID listening to Joe Rogan, who I consider basically a metabolic health podcast. Like, he's talking about these things during COVID. And then obviously Bobby Kennedy, which we can talk about, but Bobby Kennedy showed that this is a real political movement, and that people are going to vote on this issue, which is very important.
I completely agree. I see that sort of convergence of different variables, right, within media and social media and voices that have always been there, but I think more light has been, shown on them at the right place at the right time in American history. I think when we look back decades from now, we're going to see this in a deeper way, right? These sort of perfect storm in the best of ways of America being ready for this conversation. And as I've been more vocal, talking about these things for the past 15 years, running telehealth clinic for 15 years, my positions have not changed in that time. And people are, I think, just more and more people are paying attention. And it's interesting, the comments that I'll get on social media, and I'll say, well, you've changed, you've become political. And to me, what do you say to people that say that, like that are in the health side and like, you've gone political as a pejorative?
My framework is that in my head, my goal isn't to be political or non-political. It's that we need to be effective in getting a re-articulation and re-envisioning of how we see health. That the core problem, and let's get out of the politics, the core problem is that our system is incentivized and makes money from managing disease, which means more and more patients need to get sick. And to me, that's the core metric, is that 95% of medical spending right now is after people get sick. So hospitals make money when beds are full, not empty. Pharma makes money when there's more sick patients with diseases for longer periods of time, not less. Insurance even makes more money when people are sick, or they actually make money when prices go up because they only take 15%. They want a larger pie. So you go down to every stakeholder. It's just a fact that they make money when people are sick. And the goal is to change that. Now, I think if I added anything to this, it's that I do, come from a political background, and the politics does drive the policy. It's just the reality of our system. And, I'm a libertarian, I consider myself a conservative. It's like absolutely, it's bottoms up empowerment. You've been, I know, empowering people and patients from the bottoms up. But I think what I realize, I think a lot of people realize, is we can't lie to ourselves. There's top-down incentives that must be changed. We cannot go on if the largest industry in the country, makes money, is incentivized for us to be sick, and is totally, abdicated responsibility for the poisoning of the American people. Like, we have to change that. So I think Bobby Kennedy is a really interesting example. Like, this had to be channeled through voters. Like, it had to be a voting issue in order to make things happen. 3 years ago now, when Casey and I were, really starting to engage, senators would tell us, they would say, we care about this children's health issue, but voters don't really care about it. Our phones aren't ringing. Now the phones are ringing off the hook from the MAHA moms, and there's going to be action, hopefully. So again, Bobby's interesting because he could have gone either way. This is pretty much a bipartisan issue. This, when you close your eyes and listen to what Bobby's saying, you could have been at a Berkeley rally 5 years ago. This is talking about regenerative agriculture, even pharma skepticism. That used to be a issue of the left. I mean, these are not really clearly partisan issues. I unapologetically think that health is political. It became political, especially during COVID. And the fact that a party, the fact that there's this unlikely, imperfect coalition of President Trump and Bobby Kennedy, and they started talking about getting toxins out of our food. They talked at the State of the Union about a boy with brain cancer probably being caused by toxins and need to study that. This is a really good thing. And I'm actually almost certain that it's actually going to be a great bipartisan thing, because the popularity of this and the voter animation on this issue, I think, is going to force the Democrats to try to be, MAHA as well. Because I think sitting on their hands and not clapping for the, child with brain cancer is just not going to be tenable much longer.
I mean, it is such an ugly look of how toxically tribal are they, that they can't see past it, right? They're so blind by rage. It is unfathomable to me when you talk about someone's health. Like, this should be, you should have people beyond partisanship and politics, but they're not there yet, are they?
No, I think you said it. I think you said that, like, in the expanse of history, like, I think this moment, the MAHA movement, will be remembered. I think actually eventually as a bipartisan. I think in the history books, like, we're not going to remember the day-to-day infighting on the news, but there's a real stake in the ground for a new vision of health. And I always say, like, political issues come and go. I don't think that this issue is going to go away. I don't think moms are going to return to wanting, the dyes in the food, and going back to blindly trusting pharmaceutical companies, or, going back to more corruption at these health agencies, or more poisoning of the kids. So I think this issue will only get momentum. And I actually, weird way, I'm optimistic from how much the Democrats are imploding by sitting on their hands and basically through Trump derangement syndrome, not wanting to partner with Bobby or Trump on this issue, particularly on health. It's not going to play long term. I think the American people are pretty much on board with figuring out what the heck's going on with children's health, particularly, and chronic disease in general. And I've actually been speaking to prominent Democrats in the past week, confidentially. I'm not going to name names yet, but like there's actually a lot of consternation about what's going on, and I think there's just actually a political opportunity for Democrats to actually to separate from the herd and say, no, we want to work on some of these issues together. I think you're going to see a lot more of that. So
Yeah.
so it's messy, but this is clearly a bipartisan issue, and it is a good thing that Bobby, whatever you think of President Trump or Bobby Kennedy, the fact that they've identified a voting coalition on this, and that voting coalition is nimble. I mean, there were millions of first-time Trump voters from, I would say, the MAHA coalition of moms, of independents, of young people. That coalition is up for grabs. So the Republicans need to deliver on their promise, and the Democrats can fight for those voters. That, to me, actually, that's a good thing.
Yeah, it is, and you're right. I don't see the American people, American moms, American dads, people as a whole. They cannot unsee what they've seen,
No.
and it's this sort of veil has been taken over our eyes as a culture to now see the things that we've been immersed in for so long, which I think is a beautiful thing. But there is a reckoning, right? There's definitely going to be a sort of this new era shifting is going to be painful because it's deeply entrenched, and there's a lot of very powerful special interests involved in this system that is shifting. I don't want to skip over something that you said. For people that don't know your story, you mentioned your mom's cancer and how that was a pivotal moment for you. What happened there, and just this tragic story? I want people to know how this was a catalyst for your personal evolution.
Yeah, I mean, the three kind of strains from my story, again, I've been an entrepreneur for 10 years, but started my career. Casey and I grew up in Washington, D.C., wanted to be in politics my whole life. So did campaigns, but then worked for the food and pharma industry and saw some bad things and got out of that, became an entrepreneur. But then you go to 2017, my sister, Dr. Calley Means, pride of the family, Stanford Med School, researched the NIH, had a neck surgeon. She left the system really on this, she had I'd say like profound experience where she was doing a sinusitis surgery and, a third of the day. And she actually realized, okay, I'm cutting out the remnants of inflammation, but she didn't know why the patients were getting inflammation. And just realized she didn't learn that. She didn't take one nutrition class at Stanford Med School. And there's this whole basically system to basically manage and profit from the symptoms, but not cure the root cause. And then our best friend, my mom, was taking a hike in early 2021, had a pain in her stomach, got a scan, and then got a text the next day saying she had stage 4 pancreatic cancer. And again, like this is a somewhat normal occurrence, a parent getting cancer, getting sick, dying. I mean, this is what happens to everybody. But, I think through the lens, helping to put the pieces together through my experience, through Casey's experience, and then how that system, these incentives impacted my mom, where again, to me, some of the core North Stars of MAHA, what Casey and I are trying to talk about is like really through the prism in my head of my mom, which is that disease is connected. And those dynamics, if the root cause is not addressed, lead to the things that are killing us, which are happening at higher rates. We're at all-time highs: cancer, Alzheimer's, heart disease. So these things are all connected, and we don't see medical system that way. And that's the result of just basic broken incentives that profit from siloing and from management of disease. So yeah, Casey and I think through our experiences, those experiences particularly after my mom's death, really wanted to explain, and that really to me is what good energy is about. Is that it's more simple than we're led to believe on chronic conditions, and it's interconnected, and we need a more interconnected view of health.
Thank you for that. Can you go back and for people and set the stage, I think, for something that you talked about, how Casey didn't learn about nutrition in conventional medical schools, like conventionally trained physicians don't learn about it. If they do learn about it, it's very minimal. But yet
Right.
most of the chronic health problems that we're facing as a society are lifestyle driven. But there's a sort of deep history to why that is. Can you talk about the Flexner report and sort of the genesis of the model of how we do medicine in the United States?
Yeah, what I've tried to do is really because it can sound a bit conspiratorial and a little hard to grasp and just say, oh, the medical system doesn't want you healthy. Do, 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 do. It's like what I tried to do, and we do in the book, is trace the history so we could just speak to facts and just actually. I think it's easier to understand how the systems, I'd say, is weaponized and broken by design. So it's really important to understand the Flexner report, which I believe is 1909. And this is when, admittedly, the medicine was the Wild West. There was a lot of snake oil salesmen. There were, a lot of magical cures. Actually, around that time, one of the top drugs for children was made by Bayer, heroin. It was literally called heroin. They actually created the name heroin. And any baby that was fussy, a doctor would recommend that heroin was prescribed to them, and they gave literally little drops of heroin, which made the baby stop
Yeah,
crying usually, which
there
I
you
guess
go.
makes sense. So it was the Wild West, but Rockefeller was the John D. Rockefeller was the father of the modern pharmaceutical industry, and he started trying to professionalize and create pharmaceuticals from byproducts of oil production, and he became very interested in medicine. So certainly, I'm sure in his head had some good intentions, but he did, just as a factual statement, fund the first modern medical schools from Johns Hopkins to University of Chicago. And then his personal lawyer, this guy Flexner, actually basically he outsourced to Congress to create the Flexner Report, which established this siloed view of medicine. It established this view that you need to basically name a disease, insert it to a specialist department, and then serious medicine is symptom management, is cutting out that thing or prescribing a pill. And it was very rigid, and it was actually explicitly derogatory towards nutrition or any type of holistic health. At that time, there were different avenues of medicine. There was more holistic, there was chiropractor, there was kind of nutrition based health. And he was very dismissive, and he said we have to go serious medicine. It's evidence based medicine, which is basically you have to and name the condition and then prescribe it. So he had that. That actually exists. That actually it's the guardrails of medical education and the medical system to this day. And then William Stewart Halstead at Johns Hopkins really created the idea of medical residency and really ingrained. He's one of the most influential doctors in history. He really ingrained this idea that doctors are heroic. They do these long. He created the residency program where he actually people didn't know this at the time. He was a morphine and cocaine addict, and he would go on 4-day benders with his residents, and that actually instilled this idea that residents like don't sleep, they fight, they're kind of macho. They didn't know at the time he did like 6-month sabbaticals where he would have mental breakdowns between those benders on the heroin and the morphine. But that's to this day. Casey talks about this. It's like go go go. It's like don't ask questions. Casey was reprimanded for asking about nutrition interventions when somebody had migraines and 9 other comorbidities. She was told by a attending surgeon one time, you didn't go to nutrition school, you don't need to talk to your doctors about nutrition. So it kind of ingrained this idea. So I want to be clear, when you have an acute condition, when you've got like an inflamed appendix or something that's going to kill you right away, kind of siloing and attacking that does work for acute conditions. I think there was definitely some financial incentives and some bad things going on with Rockefeller. But what I also think happens is this siloed view of medicine. Chronic disease wasn't really an issue back then. People were relatively healthy when you look at pictures from a chronic. It was really acute and infectious diseases. Today, 95% of medical spending is on chronic. That's really happened post World War II. So I think people have weaponized this siloed view of medicine, and it basically just doesn't work for chronic. The first pill that anyone took for more than a couple of weeks was the birth control pill in the late 1950s. And the medical system, using the trust built after World War II for acute issues like antibiotics, which helped win the war, they started asking, how can we have more lifetime pills? The birth control pill showed that, wow, you can have somebody take a pill for a long period of time. How can we do more of that? So all R&D and all focus and all medical journals, which the pharma companies fund, they all went into a chronic. So Valium was the blockbuster in the 1970s. 30% of women were on Valium, highly addictive. They advertised in Time magazine saying it's mommy's little helper to help you get through the day. They started the psychoactive drugs started up where now 25% of U.S. women are on one of those. We started doing the statins. We started doing the metformin, the ACE. Really everything, including cancer treatment, which is very ineffective, which we spend $300 billion a year on. Cancer rates are going up. Alzheimer's, billions and billions in Alzheimer's cures, which have been totally ineffective because it doesn't address the root cause. That's where all attention goes, is to long-term cures. And this Flexner report, which explicitly discourages from a holistic, interconnected view of health, really discourages from asking how our food we eat and the toxin environment or our drugs are impacting our microbiome and underlying metabolic health, and how the heart disease might be connected to the diabetes and Alzheimer's. That's totally just not within the system. So at the end of the day, to me, we could talk about how we get there, but what MAHA represents, as Bobby represents, is I think it's a 10-year journey to actually unwind ourselves from actually this entire paradigm of medicine when it comes to chronic disease.
Yes. Yes, exactly. So you talked very beautifully about kind of setting the stage for what, if people were unaware of the medical industrial complex and how that sort of machine runs. Can we go over to big food? You were in the belly of the beast, so to speak, as a food lobbyist. What did you see there? Like, and what was your aha moment of like, this isn't right, and you kind of shifted out of that space?
Yeah, I told you I'm at Expo West right now, which is a lot of big food companies, and what I see at these conferences and when I meet people in the food industry is, they're good people, but they are professionals in the system that we have, where they're going to get fired if they don't improve the margins and make cheaper food and have people buy more food to make it more addictive. So what I saw is at the food industry is I think they take no responsibility for their impact on health, very little, and they are aggressively trying to make food cheaper and more addictive. There's a panel about how salt is too expensive, so there's tremendous innovation in actually just fake salt, because just using real salt is not is it'll help the margins a couple bit, like a sliver, if they actually they're innovating on just ways to make a salt taste without salt. There's like dozens of chemicals that are being used by companies to actually make salt cheaper. So that's just one example. They're just constantly have the best scientists in the world trying to not have real vanilla, but how do you put some chemicals together to create a fake taste of vanilla. It's just like that's what they're constantly. That's what the huge like offices for food companies that people are doing. They're trying to make food cheaper, and then also addictive. And I mean addictive in a very literal way. I've talked a lot about how the cigarette industry, consolidated the food industry. It was 50% of the U.S. food supply was owned by the cigarette industry in the 1990s. And, to me, we debate, and you have all these people come on, right? I'm sure you talk to, it's like, well, we need more evidence. It's not evidence-based, or we don't have the human randomized control studies on ultra-processed food and on these chemicals and on whether the dyes are bad. It's like completely misses the point. Ultra processed food and all these chemicals we can't produce are science experiments from a while ago, the cigarette industry, and still the legacy of that, to make the food addictive and palatable. We've
Mm-hmm.
completely lost the plot when we're asking whether it's the food dyes that are, crude oil, or these chemicals that come from, harmful compounds, which one it is. And it's the game the food industry wants us to play, to try to isolate with human randomized control studies. Oh, is it this or this? The problem is these are science experiments very intentionally to make us eat more. And then the byproduct of all these chemicals, which are unregulated, literally unregulated because it's self-policing from the FDA, the byproduct, it's not what the food company is trying to do, but what is happening is obviously these chemicals are impacting our metabolic and microbiome health in ways we don't even understand and won't understand for a long time.
Mm-hmm.
Um, and the addiction nature of the food is making us want to eat more, which is leading to a rise in American calories. So we've got the calorie increase from the weaponization of food. And I would be certain, just from the lack of natural food, just actual impacts we don't even fully understand, which just go by common sense. So that's what I'd say with the food industry. I've talked about the weaponization of trust. Right now, you have um, food industries paying body positive TikTok influencers to actually shame doctors for weighing patients. It came out a whole push to on TikTok from food companies to do healthy at any size. So they're pushing that kind of psyop, which is just a terrible idea. And then I helped food companies back, 13 years ago, pay like civil rights groups like the NAACP to say that taking soda off of a SNAP food stamps was racist. So they were good at weaponizing the debate. But yeah, that's what I saw at food companies. I think the issue tying to the pharma health is the food companies in their interest, it kind of makes sense what they're doing. The problem is they're also tied with the health industry, and the health industry isn't talking about why food is impacting our health, is I think
Mm-hmm.
the big problem is.
Yeah. Okay. So, and that's still happening today. I mean, for people, maybe they were shocked, but yeah, we've seen this in our industry. Is that big food pays influencers sort of push this sort of virtue signaling. It's really in it's so guys, right? It sounds so good when you talk about, of course, don't shame people, body positivity, but it's really to push this sort of obesity epidemic to have perpetual customers. And I've seen it on social media when we have been having these conversations about the SNAP program and subsidies towards junk food. People are still saying that. They will say that it's racist to remove junk food. And you mentioned, just so I'm getting this clear, that that's actually a move from big food. It's like a marketing angle or a spin on the topic. Is that correct?
A marketing or spend on the topic of what?
Of the removing subsidies for junk food or removing soda from the SNAP program is somehow racist, and that's intentional. That talking
Oh
point
yeah,
is out there in the ether.
yeah. I mean, you had something on the LA Unified School District shared a joint post with an influencer who was saying that the only bad food is moldy food. There's no such thing as bad food. Kids should be able to eat donuts, and it's racist to talk about, in any way say that being overweight is bad. That was shared by the LA Unified School District and funded by Nestle privately. It came out in the Washington Post that there's dozens of top dietitians and health influencers that probably attacking you and me that are secretly funded by the food industry. So what I saw, 13 years ago is that this isn't complicated, right? How to weaponize the debate. You call someone sexist, racist, fat phobic, like this isn't complicated. Nobody wants to be called that. So they're funding, now on TikTok, back in the day, it was, civil rights groups through the media. But pulling the strings of culture in this way isn't that complicated. It's what any good, public affairs PR person would do. And that's what food companies are doing right now. Um, I'll give it another example is Monsanto is lobbying in states right now. And they're not saying, oh, we need just unbridled chemicals and glyphosate. They're saying that the alternative pesticides come from China and that we need to protect American made pesticides, even though it's a German company. And that anybody that doesn't give Monsanto immunity from any legal proceeding, like the vaccine makers have, they're arguing for that in the States, is a pro CCP lawmaker. And they're not even joking. They're running ads and mailers saying anyone who doesn't support immunity for glyphosate from this German company uh, is pro China. So they find that like it's never going to be like why glyphosate's good, why kids should be drinking soda. It's like you're taking away choice from kids. You're being racist by taking away choice. One thing I will say is very interesting right now with the food industry is they're not debating the health impacts of food. They're not taking on Bobby or any of us on the fact that we have much less healthy food than any other country, the fact that kids are getting so sick, or even the tie or connection to food, right? 5, 10 years ago, Coca-Cola used to aggressively argue that sugar doesn't cause obesity, like aggressively, like publicly. That's pretty much bankrupt. They're not doing that. What they're doing is aggressively pushing the food price increase argument. And
Mm.
think about high level, it's kind of evil, right? They're actually conceding the health argument, but they think President Trump is so sensitive to food increases. They're trying to put a gun to his head on that. I mean, you know, I think that's a very cynical way to look at President Trump and his commitment to make kids healthy. I also think it's a misanalysis because the executive branch is not responsible for food prices. That comes from the trillions of dollars of completely broken subsidies that Congress has given to food makers over the previous couple decades. But that's the argument that food companies are making now. They're trying to hold a gun to the administration's head on food price increases.
Yeah, well, it's a brilliant spin, right? Because it's tickling the ear of Americans
But
because they are feeling that, but it's complete spin.
we need to get
Go
ready
ahead.
for that. We need to. That's really the only card they have. And again,
Yeah.
it's a little wonky, but I want to be clear. We subsidize food, crappy food, so much. SNAP, food stamps, is a $150 billion program. We have agriculture subsidies. We have federal school lunches that have no nutrition guidelines. So I'm dubious on whether food prices either will go up by taking poisons out of food. But there's a larger spiritual, health issue here, which is that we have the ability in America to not poison our kids. Like, we are poisoning them right now in our food with all these chemicals. The goal isn't, before anything else, it's that. It's, we're going to stop poisoning our kids. And then if there are, impacts not of any more regulation, but actually taking away the corruption that's led to this poisoning, if there are ramifications for that, Congress can address that because we already subsidize food so much. So I just want to make that isn't actually for anyone that cares about MAHA. We need to continue to protect the grassroots, energy on getting toxins out of our food and not fall for the price increase argument.
Yeah, as you said, that's one of the last
Yeah,
cards that they have. Like, what do they have past that?
not much.
Not much. And you think about this, the things that we're talking about here, chronic disease disproportionately hurts poor people. It hurts people of color. So it's like, to me, it's like, why? What is that argument? I mean, what's their argument? What's their counter argument for why we should keep subsidizing and hurting these people that have chronic disease? Do they think chronic disease is a good thing?
It's very evil when you break it down. So the reason there is so much chronic disease among lower income people, and it's a lower income American at the lowest level lives 10 years less than somebody at the highest income level, and that's almost all due to metabolic disease and dysfunction, is that this system has been totally rigged. We're really the only country in the world that pays for soda and junk food on our low income nutrition program. And then you have this SNAP to Medicaid pipeline. It's like a 85% overlap, where Medicaid doesn't have any preventative services really to speak of, but kicks in once you get sick to manage the disease. If you're a kid and have high cholesterol, you'll get a statin for life. If you're a little sad, you'll get SSRIs for life. If you have whatever. Now the American Academy of Pediatrics is saying, Ozempic for 12-year-olds. So that's costing taxpayers a lot of money, and there's nothing, no incentives for that child to learn metabolically healthy habits. So we're actually incentivizing the poisoning and the drugging. And then if you look at it from a taxpayer perspective, there's nothing more costly we could possibly do than produce sick, lower income children, because taxpayers have to pay for that. So the poisoning of the kids leads to Medicaid now being a much bigger part of our budget than all defense and intelligence spending combined, and growing much faster because we're poisoning poor people. So it's just like so that's what's happening. It just enrages me to even say this. The food industry argues we can't possibly expect to not poison people because that's going to cost too much money. Coke has actually lobbied for SNAP to be lower than it could be. They argue for it to be lower so people can only afford ultra processed food.
Wow.
And they hammer that cost argument. They pay social media influencers. I've been attacked by paid influencers to say that I'm classist and elitist. So they've rigged the system to where only lower income people can eat ultra processed food from the systems, and they're addicted to it. And then they slam anyone as elitist and classist for saying, how do we fix that? You've probably seen, Casey's been attacked for saying that people should go from seed oils to olive oil. It's like, that's true, and that would be much less costly long term for the country. But it's like anyone who talks about these things is from the food industry slammed. So we have to high level unpack these things. And I always say, look at the 4.9 trillion we spent on health, and let's step back, blue sky, and let's ask, where can that money go to prevent and reverse conditions? Now it's all going to clean up the mess after people are poisoned. It needs to go more to stop poisoning people.
Yeah, well said.
We'd be much richer. Yeah.
Yeah. Okay. So I'd love to get in the weeds on this because I get attacked too from people on the same topic, and it is interesting the parroted sort of groupthink comments. They all sort of repeat the same talking points that we're talking about today. I'd like to sort of untangle that and really understand where they're coming from and look both sides of this, because it is wild to me when you look at how many people are sick with these chronic diseases, but they want to keep doing the same thing, expecting a different result. The people that are on social media right now, and what I would call, if you my Hunger Games reference, like the Capitol in a way, where these people are, and we're in District 12 over here talking about the people, but they will say, like, how dare you speak on this? And this is because of capitalism. Capitalism is the problem, and you're elitist for even talking about this. We just need more socialized medicine. We need socialized food systems, and it's racist to remove junk food from it. But yet what you're talking about isn't capitalism. Like, the system right now is not capitalism. It's maybe crony capitalism. It's maybe some corruption between the government and, when you talk about subsidies to junk food, but it's not true capitalism. So what do you say to that argument that says the problem is capitalism and you are supporting a party or an administration that is for deregulation, and they're the problem to begin with?
This has been a complete bastardization of the free market. We don't have a free market. So let's just look at agency by agency. The NIH has been completely co-opted by private interests. Researchers there make hundreds of millions in royalties, which are unreported. It's this revolving door between pharma and industry and the researchers there. There's no conflict of interest rules with where their grants go. And now 90% of NIH funding goes to pharmaceutical R&D and not to foundational research on why we're getting sick. That flows into the FDA. Now, the FDA itself is the drug approval department, is 75% funded by pharma. Pharma is able to lobby. This is just shocking, and it should be changed. But this is an antagonistic group to pharma. Pharma should do good things, should exist, but like their regulatory agency, right, is to regulate them, is to make sure that these drugs are safe and effective. They are 75% funded by pharma. So a bureaucracy is always incentivized to grow, and they grow when pharma gets bigger. And 11 of the 12 last FDA commissioners, literally the next day after leaving the office, went to a pharmaceutical company. So there's a total revolving door. And you just had the head of drug approvals just immediately. She left from Pfizer, went in, and then went to Pfizer. And she did some really shameful things. So that's the dynamic at the FDA. And then you get to, okay, so you have your research, you have your drug approval and device approval pipeline, and then you get to the CMS department, which is the most important department that we probably don't think about enough. Like, CMS actually is the biggest department in government. The budget is almost $2 trillion. Dr. Oz will be taking over a 2 times larger budget than the Defense Department. That's what pays out the Medicare and Medicaid, our 2 biggest entitlement programs. And the logic of how we reimburse is from the American Medical Association. So, okay, let's break this down. So our government outsources medical decision-making and logic to the American Medical Association. That's not by law. That was just a choice that that administration's made. The American Medical Association is a pharmaceutical lobbying group, just demonstrably. It is a pharmaceutical lobbying group. And they, for their medical decision-making, they outsource to specialty groups like the American Heart Association and the American Academy of Pediatrics, which are wholly owned subsidiaries of pharma. The 2 biggest donors to the American Academy of Pediatrics are Abbott, which makes baby formula, and a bunch of pharma companies, including Novo Nordisk, which makes Ozempic. So that's the dynamic that we have. So when you say, oh, is it socialism or no, we have a corporate captured system where literally the pharmaceutical industry owns the FDA. it's guiding medical research, and a pharma lobby group controls the logic of our entire standard of care. So what Bobby's saying is and actually it was interesting at the hearing. They were asking that the Democrats were like, "What about Medicare for all?" And the Republicans were like quizzing him on like nuances of Medicare Medicaid policy. Bobby's point, the MAHA point, is actually have a larger problem than even that question. It's not Medicare for all or this. It doesn't matter. We have a corporate captured system above that. Even if you have Medicare for all, you still are subject to the codes of the system, which are incentivized to profit industries. So, they rigged the insurance standards to where, the 15% medical loss ratio, you're actually able to raise premiums to get a bigger chunk of 15% of a larger pie. That's why premiums have gone up. Every single part has been so industry will weaponize Medicare for all. Like that's not the issue. It's not about the nuances of health policy. It's about the underlying incentives. And that's the message that we need to talk about, and Bobby's going to talk about, and what we need to get to. So yeah, that would be how I would think about it.
Yeah. Okay. That is fascinating, and it's true. I mean, almost from a health standpoint, we're talking about getting to the root causes with what we do in functional medicine. This is getting to the root cause of the quote unquote disease or the dysfunction of how government works, and it's not a true free market. We're not talking about capitalism. It's the corporate capture, which historically, as you mentioned at the top of the conversation, has always been a left of center thing. Like that was something they could admit. That was something but now it's seen as like MAGA to talk about corporate capture, and something that Democrats are now raging for the machine. When did that great realignment happen? Like, and why did it happen?
It was propelled during COVID. I think Trump derangement syndrome is a important dynamic in American politics. Whatever you think of him, I think most would agree President Trump is, I think, the seminal political figure of the past several decades. He'll be the figure that's written about in history books for better or worse as a person that's really defined this era. And he, I think, has made a lot of people's brain explode. I was very anti-Trump back in the day. I've evolved on this. And now I think my vote for him in 2024 is the most important in my life. But the fact that Donald Trump was against Fauci, and Fauci kind of represented the experts, I think led during COVID for the Democratic Party to be solidified as the party of trusting experts. The Democratic Party was Democratic elite intellectuals were the people questioning vaccines back in the day. That was an elite kind of liberal thing to do. If you looked at polls of who was anti-vax, the more liberal and richer people actually were more anti-vax. I mean, just as a statement of fact, it was a point of pride for intellectual liberals to be skeptical of the pharmaceutical and insurance and the big food industry. When you think 10 years ago about a liberal, that was somebody who did psychedelics, who went to farmers markets, who was skeptical of vaccines and pharmaceutical companies. So this wasn't obvious. But I think what happened is COVID was a very important moment. And Trump and the Republicans were branded as a little bit more skeptical. That was led by Jay Bhattacharya, who now amazingly is NIH director, who was saying we shouldn't shut down schools. So because Trump was kind of against the experts, the Democrats just fell in line. Oh, we need to trust, the teachers unions to lock kids up at home. We need to trust Dr. Fauci. And it's actually morphed into a trusting of big food. So I believe actually that there's been a historical level psyop of the Democratic Party to use social justice issues to get them to carry water for an evil corporate agenda. It's actually astounding. I was chatting recently to a very high level Democrat who I do believe that the Trump derangement syndrome has reached stage 4 and infected their brain, and I think it's terminal. I think it's never coming back. They were unable to use critical thinking skills or put together a coherent sentence about anything good Bobby's doing, and we're a drone just basically saying that we need to listen to big food and big pharma. I mean, that is how Trump derangement syndrome has infected the left's brain. I think you see it again, at the State of the Union, where the Democratic Party would not stand up and clap for a child that is overcoming brain cancer. I mean, this is a historical level collapse, I think, of the
Hmm.
party, honestly, and I think that they're actually going to have to come back and play ball on some of this stuff, as I said. But that's where, I think for whatever reason, the Republican Party is about skepticism of the experts now, and the Democratic Party is about trusting the experts. And I think that's a losing side for the Democrats
Hmm.
because the record of the experts has been one of utter failure.
Yeah. It's fascinating when you look at health, even when you look at COVID and the pandemic, and then all of this MAHA conversations now, is that so much of the awakening and the realignment had to do with health. And that's why people
Yeah.
in health are having this conversation, because it's the center of this realignment where it's, to me, I'd be curious to get your thoughts on this. Is like, is this the beginning of, and time will tell for sure. None of us are fortune tellers to this, but I could see this being the beginning of a larger party reimagining,
Oh, yeah.
because it's sort of like the statists and then the populists, which are, there's independents, liberals, traditional Democrats, Republicans, libertarians, all there. That's my perspective as someone not in politics, but is this like just the beginning of this realignment?
Yeah, I think what the 2024 election represented, and particularly the MAHA moms kind of dynamic, is one of the four or five biggest realignments in American political history. Um, you would have been called crazy for saying that Trump would win 50% of independents and 50% of young people, if you said that 4 to 8 years ago.
Mm-hmm.
Um, Trump was supposed to lose the gender gap by 22 points. I think it was 7 points he lost it by. Like it dramatically closed. If men overwhelmingly vote for Republican, if you close the gap on women, it totally reorients the structure of the parties. Democrats have depended on young people. They've depended on independents. So I think with President Trump, basically, I would say using the Republican Party, but putting some new ideas in there, putting a more deeper populist skepticism of corporations. You wouldn't have, couldn't have imagined 12 years ago a Republican president at the State of the Union talking about tariffs and the entire
Yeah.
party bursting into applause. Like
Yes.
you do have this kind of reorienting of the issues. I think you used to have the Reagan school of foreign policy hawks, economic conservatives, social conservatives. There's still a bit of that, and I think those issues are important. But I think Trump is forming a new coalition. I would say actually it's about a war on kids. I think you could actually frame a lot of this movement on, what the heck is happening to kids with education, with keeping them locked down, with, I'll just say that the men and women's sports and the gender transition surgery on kids when I was at a rally, just as a factual statement, those issues were the loudest applause issues, like visceral frustration among voters, particularly when it comes to like boys and girls sports, and then what's happening to kids with the gender stuff. I mean, that was animating people. Like parents are pissed off. They're pissed off about what's happening in schools. They're pissed off about what's being put, the toxins in kids' food. They're pissed off about the drugs. There's kind of actually, they're pissed off that we're sending kids to wars, for the past couple decades that aren't really working out, and there's a military industrial complex that profits from sending young people to I actually think you can tie it to like this corruption that
Mm-hmm.
that is impacting particularly kids. So I think there's like a new movement that's
Mm-hmm.
Trump has formed that could reorient politics.
Yeah, I definitely see that. What do you, as of recording this, Bobby had released an op-ed on Fox News about measles, and I see people in our space on the other side saying
Right.
he's sold out to big pharma because he was talking about the measles vaccine. I mean, I get his perspective. I've known his perspective all these years, but what's your take on that and people within the health and wellness community, quote unquote, and they're kind of, upset about that op-ed?
Yeah. A macro point on this. I want radical change. It is absolutely an undeniable fact that this is a 12-year effort. I think MAHA is a 12-year effort, and I think Doge is a 12-year effort. We need to have continued momentum and political support to completely dismantle incentives that have been put together over the past 50, 60, even going back to the Flexner report, over 100 years. So we activists should continue to call things out, to continue to animate, but we need to understand there's so much pressure and so much, deep state actions against Bobby. I do think we need to understand there's going to be a ton of setbacks. There's going to be a ton of things that piss us off. We need to keep this movement together. I think it is important to give this movement a chance. When it comes to that op-ed, there was that headline about the vaccine. They didn't write that headline. If you actually read the op-ed, it's actually for the first time the government talking about vitamin A, talking
Yeah.
about actual patient choice for the first time ever in a government op-ed from an HHS secretary.
Yes.
It actually had a lot of interesting and I think very powerful and unprecedented parts of that op-ed. I'm not going to litigate every part of the op-ed, but I actually think the headline was written by somebody else, and it's actually, there's a lot I think people can like in that op-ed. I think there's no question that this measles thing represents that this larger dynamic that's going to happen day after day after day, and we can't fall for it. I am in no way, in any shape or form, delegitimizing or saying that the measles outbreaks aren't important, but they happen every single year. And when they happened under Biden, we didn't hear one thing about it. We didn't hear one thing about it. This is a absolute dream of the mainstream media that there is a couple measles cases right now. It is an absolute dream. And I think you tweeted about this or posted about this recently, that we are being absolutely gutted and devastated by chronic disease, which was not spoken about in the Biden HHS priority document. They mentioned vaccines over 20 times. We have to prioritize. I know that Bobby is very focused on empowering HHS to have best-in-class infectious disease management protocols. He is not standing in the way of that. But we must realize that we have a limited amount of time to focus on big issues and not fall for these distractions, because this measles thing is part one of what will be a story with hundreds and hundreds of chapters of unrelenting distraction on Bobby getting his agenda passed. So I think it's a little warm up for us. We should not delegitimize the importance of measles or the importance to get this under control, but we should, let Bobby and his team address that and empower him to talk about really what are the most important health issues that have been ignored, which is around chronic disease.
Yeah, thank you for saying that. You're absolutely right. I think that when you look at the context is lost, and you think of the larger, like, where is this coming from? These cases like this happen year to year, but sort of the attention and the groupthink and sort of the parroting of the fear mongering around this is happening for a reason. It's in the headlines for a reason. And I agree with you too that the Bobby's op-ed in Fox News has been what he always has said. He's for informed consent. He's for transparency. He's for people having personal choice, for people that maybe have an autoimmune condition or can't get the vaccine. And he's always been open to the fact that his family is vaccinated. He's never been anti-vax. And that's part of the massive psyop and smear campaigns on him for years, because he's always talked about this, talking about transparency. Maybe this is a question for you. Like, why is transparency so offensive and the pejorative is anti-vax when we're really just talking about data, research, transparency, and gold standard science?
I'm going to say this right now. I think the health elites, health community has made a massive, massive mistake by not acknowledging any nuance in the vaccine debate. And I think it is just the height of arrogance coming off of COVID, where almost every single public health guideline from the government, which was said with breathless certainty, turned out to be wrong. And every American saw that. To just say again, just blank slate, slander Bobby as anti-vax for asking for transparency. I think what Americans have seen is he's not saying all vaccines are bad. He's saying whenever we're told not to ask a question, that is the definition of being anti-scientific. He's saying that we have different vaccine schedules demonstrably than other countries. Is it not appropriate to continue studying that? there's been many uh, therapeutics that have been removed from the market for causing death and issues for kids, and they've been studied and revised with hopefully safer therapeutics. Like in 20 years, are we successful if we're the exact same that we are today on the vaccine schedule? Are we like, is that would be a total failure? Like
Mm-hmm.
nobody would acknowledge that we'd be in a good situation if we don't evolve to more personalized therapeutics, to understand people's genetics, to understand different differences in people, and study vaccine injury and figure out safer routes. Like what the medical system's arguing right now is basically that we're at the top of the cliff, that we're at the top of the mountain, that we're never going to be better than we are today, that we're never going to learn new things. That just demonstrably obviously makes no sense and is completely
Mm-hmm.
unscientific. So I think, I haven't been, this the vaccine issue isn't where I've come from, and I've definitely learned a lot. But I actually think it ties to everything else, because I think
Mm-hmm.
Americans get really skeptical now if the system's telling people to shut up, not ask questions, not have transparency. Actually, Jay Bhattacharya being badgered um, to actually not even study certain potential hypotheses on autism. It's just like that's a red flag. Like
Yeah.
like it's much wider than vaccines. It's We need to leave every stone unturned. We need to continue to conduct science. I believe this with all of my heart, is that Bobby wants the American polls that show Americans' trust of vaccines. He wants that to be higher. It's
Yes.
actually a metric he
Yes.
really cares about. Like he doesn't want to bring down vaccines. He wants to raise that number of people that trust vaccines. And the reason trust in science is going down is not because of Bobby Kennedy. It's because the medical community has continually lied to us. It had a
Mm-hmm.
disgraceful showing during COVID when they said we're racist for suggesting it came from a lab. Said that the COVID shot would prevent transmission. That we should still to this day give the COVID shot to 6-month-olds. Um, they're still saying that today. Like they're saying that 6-month-olds need the COVID shot to go to school, and saying trust us on everything else. It doesn't. Any logical person with a brain and critical thinking skills would want to double check what the medical guidance we're getting is right now. So this is a crisis. It is a crisis of trust that's caused by the medical system. And in order to regain trust, it's imperative to call that out, ask for more transparency, instead of putting our head in the sand and badgering the American people to not ask questions or kicking them out of
Yeah.
pediatric practice if they do.
Right. Well, it's another thread, like you said. You didn't really come into this movement and conversation through vaccines, but it's exactly connected to the food in the sense it's corporate capture. It's
Of course.
corporate capture and spin and suppressing data
And I
to
don't know why
push
we
a
can't just
narrative.
talk about that. I don't know why it's even controversial about this.
Right.
Like people on the ACIP committee are completely conflicted and have made tens of millions of dollars on royalties from pharmaceutical companies. Is that appropriate? Um, is it controversial to say that vaccines are very important, but it's also a problematic economic incentive to have this like holy shroud over that category of drugs, to where if you can lobby to get on the schedule, you're mandated for every single child in America, and a parent who asks questions is a war criminal when there's a massive economic incentive to get more drugs on the schedule. Um, is it problematic to ask about the fact that we have different guidelines and recommendations, that other countries don't say that a parent is committing a war crime for not injecting their child with a hepatitis B vaccine on the first day of life, which is an STD? I mean, like these are reasonable questions.
Mm-hmm.
I think the medical community thinks that this issue is too important to ask a question about, which is almost the definition of an anti-science mindset.
Mm-hmm. Yeah, it is. It's more religious and cult like more than anything else, right?
So yeah, I
Um,
think it does represent a much wider issue, and it's not something I really have been involved with, but I think it does represent what Bobby should be doing on every. It's like let's ask questions, and I think his opponents in the elite medical community I think they've really overplayed their hand on. They're even saying it's anti-science to question pesticides. Yeah, it's just like these arguments are getting very tired, very tired.
yeah. Yeah, very much so. So for people, there's going to be lots of people that share this episode. Can you, and they maybe only heard what they saw in the mainstream media, that Bobby was going to take vaccines away. And according to that Fox op-ed, it's the complete opposite. You can start seeing the nuance in the context of what he's always stood for. But what are, for people that never heard the real full truth, what are the top three things of the MAHA movement that we want to put out and make happen?
There are three principles Bobby and President Trump talked about that will lead to generational change. The first is getting back to gold star science. This is really important. You had an incredible testimony from Jay Bhattacharya recently where he talked about how almost $0 of NIH money is going to study the root cause of chronic disease, how 90% of NIH funding is going to pharmaceutical R&D. The backbone of medicine is research, and the research has been captured. I think actually the NIH and unimpeachable research is like the top of culture, and everything goes down from that. That the NIH research is showing that we have an interconnected diabetes, obesity, and heart disease crisis from food and the toxins in our food and our environment. Research keeps pouring down for the standard of care not to address that and for us not to take action. People listen to the research. People, for better or worse, listen to Dr. Fauci when he said to take vaccines. Most people did it. We listened to the food pyramid. Um, a lot of these things for worse. When it said to eat carbs, we listened to the Surgeon General when they said stop smoking. Like for better or worse, we listen to medical authorities. So getting control of science is number one, and that's going to be a big goal at the NIH, which I think would be a generational accomplishment from this administration. Number two is getting conflicts of interest out of the science. It's what we talked about with the FDA being paid by the pharma industry, the royalties at the NIH, the AMA stranglehold on our medical codes. Just start chipping away at the foundational incentives where our institutions are corporate captured. That's step one before any other policy, because that just, people want to do the right thing, I think, at the end of the day, but they're guided by incentives. So changing the incentives of our health system is really important. And the third one is reverse the chronic disease crisis. And I think that's from taking better approval pathways from less corrupted FDA and better science, and having really a change of our standard of care, having more flexibility for patients where they're not just immediately given Ozempic, but can use their medical dollars and work with functional medicine doctors and get blood tests, explore how root cause lifestyle interventions can reverse or prevent disease. So those are the three areas. Gold star science, reverse the conflicts and get the conflicts out of the scientific agencies, and reverse the chronic disease crisis by getting back to root cause health.
Love it. Well, beyond the hyperbole, that should, in my mind, I know that maybe I'm being too Pollyanna, but I think that should bring almost everybody together. If you're not nefarious, or if you're not a Disney villain, I think it should bring us together. Before you go, the podcast is called The Art of Being Well. At the end of every episode, we have your Art of Being Well. I'm so excited for this. This is Calley Means Art of Being Well. First question is, what's the worst tasting healthy food that you eat? It tastes freaking disgusting, but you eat it for its health benefits.
Casey is telling me to eat a ton of fermented food, and I actually don't love shoveling the kimchi and the sauerkraut down, but we get big tubs, and I heard that you need to eat a lot, so I just kind of like wolf it down, just feeling like it's a healthy thing to do, but I actually don't really like it.
I love it. That's a good answer. Do you take supplements? And if so, like what are two maybe out of the box, lesser known things that people should know about?
I think there's a lot of interesting research on timeline, the timeline,
The urolithin
mitochondrial
A.
health. Yeah,
Yeah.
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 And I do think it's all about the basics. And I try to stick to that. But I've known that team, Casey, really has dug into the science. And I encourage everyone to, like, if they're looking at supplements, like a lot of people I trust really like it. I do, feel good about it, taking them. And I don't know if it's a placebo effect or a change, but I do feel better taking those pills. Other than that, I think there's astounding research on omega threes. I try to eat, I try to get that from food, but I take momentous omega threes every day, which I good, and then a good multivitamin. with supplementation of vitamin D. But I try to stay to the basics. But I'm trying the timeline nutrition.
Got it. What is a book that you've read? It could be fiction or nonfiction. It doesn't have to be health, but it could be. That just got you thinking in a different way. I'm getting this running Art of Being Well book club, but what should I add to the list?
Food Fix from Mark Hyman was a seminal book in my life, and it actually is being re-released. I've actually been talking to Mark, and he's kind of rewriting it for the era we're in right now. So I'd encourage everyone to get that. And I do think probably a lot of listeners have read that book, but it really was a seminal book for me and Casey, understanding the incentive problems in healthcare.
Yeah, it's a great book, and it was like this political food book, and it's more prescient now than ever to be kind of come out, be re-released.
And this isn't on the health front, but I everyone has the Robert Caro books. They're these big books on LBJ. Everyone I know in politics has them on their shelf, but I've never read them. I actually last year listened on audiobook, but like they're actually not even to book 5. They haven't even gotten to the presidency yet. It's been 4 1,500-page books, about his Congress campaign, the Senate campaign, his Senate career, his vice presidency. But they are the best books I've ever read in my life, and really powerful and germane to politics today. I think a lot of lessons as I'm like navigating through that a little bit. So if anyone was ever thinking about reading those books, I would highly recommend them. Some of truly the best books I've ever read.
Wow. Great addition. Great addition. Calley, honestly, this has been a blessing. Thanks so much for coming on. Can you tell people where to go to get the book? Tell them about TrueMed. Tell them about and chronic disease. You have so much really exciting stuff going off.
Yeah, I'm so grateful to be on this journey with my sister and amazing leaders like you. I feel like we're all just kind of loosely working together to chip away at this. So I started a company called TrueMed. You can go to TrueMed.com. We have a high bar, but high level, the best supplements and exercise equipment and food in some cases. These things can count for HSA, FSA spending. If you have a doctor's note, maybe in your practice or other functional medicine practices, sometimes write letters of medical necessity for lifestyle interventions. If you have a recommendation from a doctor, you can use tax-free money on root cause interventions. Medicine is what a doctor says can help prevent or reverse disease, but most doctors don't understand how to write those notes. We do that through a simple telehealth process. So you can go to TrueMed.com and, if you have sleep issues or, need to exercise to prevent prediabetes or something like that, you can get your Peloton, 8 Sleep, Athletic Greens, down the list. Top brands we partner with and can help unlock tax-free spending. Have a group called In Chronic Disease that's come out of this work where we're really just trying to support Bobby and support just this bipartisan movement really in any possible way. We've helped do some Senate testimonies, and we're helping with these bills around the country. We're really hoping to get you involved. We're just trying to be a supporter of this uprising in states around the country for the MAHA movement. And then, Good Energy is available everywhere. And I'm, on the socials at Calley Means.
Calley, you count me in, man. Anytime.
Thank you.
You know I'm in.
Yes, sir.
My friend.
Yes, sir.
Thanks for coming on.
Thanks, Will.